Okay, good afternoon, everybody, and welcome. Happy Friday to you. Welcome to day 5 of the Georgia HFMA 2023 Virtual Spring Payer Forum. My name is Bill Ikest. I am a past president of Georgia HFMA and have been moderating and facilitating these payer forums now for several years, and just really wanting to emphasize the importance of collaboration between providers within Georgia and the major payers in the state. So sit tight for us here for just a minute. We're going to let people continue to sign on. We are scheduled to also have Humana present at 2 o'clock. If we're done early, I'll just pause the webinar and come back to it at the top of the hour, because we are on the same, we are using the same link for the webinar. So I'll give it just a few minutes here, and then I'll give a couple more instructions. Thanks so much. Yep, we still have a few people joining, so let's give it a few minutes. We'll give it just a couple more minutes here and we'll get started. Folks, I hope it's bright and sunny where you are today. I know it's not in Atlanta, but I told Tara she certainly brings sunshine to wherever she is today. She's looking all bright and fancy today. So we appreciate you shining your light on us today, Tara.
Thank you, Bill.
Absolutely.
Give it just a second. I got a few more here signing on. Can never tell with Fridays, you know. I mean, it's just one of those things. People sign up and then say they get a better offer or whatever. But again, if the weather near them is like the weather near me, it's not a day for being outside. That's for sure.
Sometimes Friday is the only day you can get anything done or participate in anything.
Yeah,
that's about right.
But also, you know, spring break, we've got to factor in that.
Yeah.
Spring break happens in different counties at different times. So I feel like everybody's in spring break mode with their kids.
For sure. Yeah, I think you're right. All right, go ahead and get started, and we'll give other people will join as we go along. But I would ask all of you, if you have any questions for Tara or Blanca, please utilize the Q&A or the chat on your screen, and we'll share those questions with them. They're going to update you on some 2023 updates for Ambetter, and understand that Ambetter is under the Centene umbrella. If you have other questions you need to present to them, by all means, throw it out there. If they can help, they will. If they can't, we'll certainly get back with you with the information that you need. But again, we've got this presentation scheduled, then we've got another one scheduled at 2 o'clock. We probably won't start early. The presenters are not ready to start early, and I want to be respectful of anybody that specifically scheduled 2 to 3 Eastern time on their calendar today for the Humana presentation following the Ambetter presentation. So it's been a good week. We've had a lot of good dialogue and communication with the payers, and I want to thank the folks at Ambetter and Centene for their continued support of Georgia HFMA and our payer forums. We're anxious at some point maybe to be able to get back together in person, but right now this virtual format continues to work pretty well. So with that being said, Blanca and Tara, I'm going to turn it over to y'all, and let's see. Tara, are you sharing your screen, or is Blanca?
No, I'll be sharing my screen, but I'm gonna while I'm sharing my screen, I'm gonna let Blanca kick it off and I'll follow up with the presentation. Is that okay?
Oh, that
Blanca?
would be, yeah,
Absolutely.
that would be great. All right, I will turn it I'll turn it over to y'all.
Yep, thank you. So good afternoon, everyone. My name is Blanca Rodriguez Russell, and I am the Senior Manager for Provider Relations in our Atlanta region. And with me is our Senior Director, Tara Freeney, and we will be speaking about our Ambetter product. And she is pulling up the presentation for us now. And of course, if you guys have any questions, please be sure to add them to the chat, and we will be more than happy to supply you a response. But we are truly excited to be here with you guys today at the Georgia HFMA, and you know, really value many of you that are our continued partners. So thank you so much for attending. Happy Friday to everyone.
Thank you,
Tara,
Blanca.
go ahead and put that into presentation mode if you can. We're seeing all your slides over there to the left.
Oh, you are? Okay, let's see.
Couple options, either down at the bottom there if you want to.
I was gonna say right at the very bottom, Tara, there's
the pull down, the kind of the pull down screen next to your volume down there. What looks like a little pull down screen along the bottom underneath the presentation.
Is that it?
No.
No, unless it's frozen. Hold on, let me see.
Let's see here.
I'm requesting to, if you can give me
Approve.
permission, I'll click it for you,
Yes.
Tara.
Because I don't think it's happening fast enough.
Yeah, I think we're having a lot of weird service. It's storming over here by me too, so let me see here. Let me see if it works for me.
Yeah, right there.
Yeah, there it is. Because it looks presentation on my end, and that could be just me. Okay.
And I'm clicking it on mine. Can you see it on your end, Bill? Because
No, well, I see you moving, but I don't see that.
and I've
Yeah,
clicked on it. And
it's right there. Tara, do you see where she's clicking? Are you able to click that on your screen? Right
No.
there at the bottom.
Because I can't see. Let me see. Let me pull it up.
for some reason, it's just
I just want to make it a little bigger for you.
yeah, it's just not working for some reason. I'm sorry. I don't know why it's doing that. Slideshow.
And just a reminder, ladies, if you'll send this to me at the end, if you will, just so I can have it to share with folks, I would appreciate that. So.
Okay, well, for some reason it's not working, but I think to be respectful of everyone's time, we're just gonna have to just push forward.
Okay.
With
Okay.
what's not going on here.
Okay. So thanks everyone for joining. Again, my name is Tara Freeney, and I am the Senior Director of Ambetter here at Peach State Health Plan under the Centene umbrella. But Blanca, do I need to share now?
Yeah, try to do it again now.
Okay, let's see.
I think once I stopped helping you, it knocked you right back out. Sorry. This modern technology is helpful, but then
I
not.
know.
There we go. It looks
Okay.
perfect.
That's good.
Yes.
Great. Wonderful. Okay, today I want to give you guys just a brief update on our 2023 Ambetter product, what we've got in our market, and a look at our ID cards for our members. We have a lot of training materials, but I thought those would be really good for us to start today. I know that you probably have questions, and once I complete the presentation, it's just about 4 or 5 slides, we can dive into our questions. Let's see, it's going to pass. Okay, so here is a visual of our networks. Currently, we've got our Ambetter Core, which has been in the market since 2014. We've got our Wellstar Select, which has been in our market since 2022. And that is a tailored network with our Wellstar Health System. We have our Plus Select network, which is a tailored network with Piedmont. We have our Ambetter Virtual Access, which we kicked off in 2023. And that gives our members a virtual option with a virtual PCP. And then we have our St. Joseph Candler Select network that kicked off in 2023 also. And that's a tailored network with our St. Joseph Candler Hospital System. And when we refer to any network as tailored, that means a member must receive services within that hospital system or hospital network in order for services to be paid as in network. So not all of our select networks and our virtual access are available in all our counties. Currently, our core and our virtual are available in 149 of our, 149 of our 159 counties. We are not statewide. Our select for St. Joseph Candler is in Chatham County. Our plus select with Piedmont is in Henry, Fayette, Newton, Coweta, Walton, and some zip codes in Fulton. And our Wellstar Select is in Cobb, Cherokee, Douglas, Paulding, and partial zip codes in Fulton. So we started out with just one network, our core network, and we branched out into adding 4 additional networks for our members. Below our ID cards, we wanted to make it really obvious for our providers to ensure they knew what network our members were in. So currently, this is our core ID card. Next, we've got our plus select card, and see over to the left, it's got our select verbiage and highlighted so that as members come into providers' offices, they can see that, okay, this member has something different. They've got the select network.
Is this card different than what they've been used to here previously? Is this something that's just recently been implemented?
Yes.
Subscribers that are active in 2023 then would get this new card.
Correct. And everyone got a new card. So if you've been a subscriber since 2021 and everyone got a new card in order to highlight where they are. We thought that would be a way to minimize member and provider abrasion. Okay, that's our plus select card. This is our St. Joseph Candler select card. Again, it's got the select on the side, and here in underneath, it references St. Joe's Candler select network coverage only. And again, this is our Wellstar select card. It's got the select to the left. It's got the verbiage. It will say Wellstar select network coverage only, and it also has a Wellstar logo. And this is our virtual access card. Virtual access on the left, and it'll have virtual access network coverage only here at the verbiage on the card.
Tara, what is the barcode that's on that card? What does that provide for the policyholder?
The policyholder can scan the QR code, and it will bring up information about their plan, their co-pays, and take them to the member portal also.
Okay. Yeah, you or Blanca may want to, when we're done here, assuming that we'll be done a little bit early, you may want to go out there to the portal and just give people a little sense of what that's like in case they're new to their role or something. I'll leave that up to y'all, but if you want to just touch on that and give people a comfort level with how to navigate the portal, that would be great.
Okay. So here are our network rules. So if you're an Ambetter Core member, you have full access to all providers and practitioners within the Ambetter network. And there's no out-of-network benefits aside for emergent care. So if you're a Plus Select member, that means you're within our Piedmont network. You have access to Piedmont Health System, and everything is out of network besides Piedmont, the Wellstar Select, Virtual Core, and St. Joe's Candler. When you're a Wellstar Select member, your network access is, of course, with Wellstar Select. Out of network is the Plus Select, Virtual Access, Core, and St. Joe's Candler Select network. If you're a St. Joe's Candler Select member, your network access is St. Joe's Candler Select network. Out of network is Wellstar, Virtual Access, Ambetter Core, and the Plus Select network. And if you're a Virtual Access member, you have access to the Ambetter Virtual network, our Ambetter Core network, and out of network for you is Wellstar Select, Plus Select, and St. Joe's Candler Select. And these slides are meant to be used as a reference guide for providers so that they can understand, okay, if I've got a member coming in this network, what options are available to them? And also on our Find a Provider, the networks are also highlighted. So if perchance you need to research a provider on our FAP, you can do that and select which product, which network you want to search. So we wanted to make that really obvious. Again, here you can see our Wellstar Select, our virtual access, and then our bronze, silver, and gold, which is our core product. And this begins our appendix part of the presentation. Really wanted to give just some quick tips on Ambetter claims. We garnered this information from our corporate claims team to understand, kind of what are some of the issues we're seeing on the provider side. So here are just, kind of a tips when you're filing claims, things that will make it easier for your claims to adjudicate first time.
That is certainly one of the goals.
Yes, it is for both of us, payers and providers.
Yeah.
Okay, and this is our 2023 portfolio, just listing all of the plan names that we have, and I won't read through those. Again, this is our appendix. So I will stop sharing. Are there any questions? I know I went through that quickly and, giving the 2023 Ambetter update of what we offer in our markets, but are there any direct questions?
I guess I would ask you and Blanca on behalf of the group, are there any particular issues that you're hearing from providers that seem to be common things that come up, and would there be any direction that you would give everybody as it relates to that? You know what I mean? I mean, from your perspective, when people reach out to you, I suspect that after a while you're saying, oh, this isn't the first time I've heard about this. Are there things that are maybe more common that you're hearing about that you would want to share with providers that maybe you've learned as a result of talking to multiple providers about the same issue?
Yes.
I would love to chime in on that. Dealing with providers regularly. I think the one issue that we get mostly, and it's probably dying down now since the Select product came into the network in January of 2022, is Select members coming to their establishment and they're not a participating provider. And at one time, they were unable to really have some sort of clear, loud identifier that this member is not a core member, that this member is a Select member. So those insurance cards that Tara shared with everyone really was one of the things that we took into complete consideration for our provider network and ensured that we created something a little bit more loud and more out there. So when validating eligibility right at the front, you will see that those cards are clear indicators that the member is a Select member and not a core member. So unless you're Piedmont, unless you're Wellstar, unless you're Candler, those are the only Select that is tailored. The Select market is tailored to those three providers. And unless you are one of those, if a Select member comes to your establishment to have services rendered, then that should be a clear indicator that you guys are not participating. Of course, this would not be something that would apply to an emergency room visit.
Sure.
If it's an emergency room visit, then we know that, we service all members at any time.
Right.
And I suspect that that's going to happen, especially as this time of year, people are traveling out of town, they're heading down that 75 or 85 corridor, and, they fall outside of one of those Select networks. So.
But it's definitely has gotten a lot better, and we definitely do always listen to our providers and try to make enhancements that will, lessen any type of abrasion or confusion. So thank you all for, being very heavy on letting us know, where we can improve, because we definitely take those things into consideration and make sure that we implement stuff for the go forward.
Right.
Any feedback that you would give the attendees as it relates to, I assume you're encouraging them to go out to the portal to status claims, use some of the online tools available to them. But if they do need to escalate something, what is the appropriate?
So I will give you the rundown. Our web portal is used as eligibility for Ambetter, of course. Claim submission, if you choose to do so. If you have your own clearinghouse and your own process, of course, you can, submit as you like. You can review claims and status of your claims on the web portal. Of course, you have to be signed up to use the web portal with your email has to be unique. and cannot be someone else's. There's no shared emails that will allow you to log in. You're able to see what patients are tied to you if you're a PCP. You are able to, of course, see the member's plan and what type of benefits they have on their plan. You know, have they gone to ER visits and pharmaceutical things of that nature, authorizations that have been obtained in the past. You are able to submit a reconsideration, not appeals, but you are definitely allowed to submit a reconsideration for a claim that you are disputing, timely, of course. And so that's really the kit and caboodle for our web portal. If you have, everyone should have their own dedicated provider relations representative. We have a territory list that's on the unsecured side of our website, which will let you know that if you have an issue and you're in a specific county, to reach out to your provider relations representative for assistance. My team is dedicated, we'll call the key account team. So I'm dedicated to the hospitals and the CINs that are attached to those hospitals in my team. So for example, Grady, Wellstar, Piedmont, Emory, all of the EHNs, Gwinnett IPA, TCHN IPA, Kids Health First IPA, those things will all fall under my team. And of course, we're out there on the territory list as well with names, phone numbers, and emails. Accessible to any of you if you have any questions. If you need to escalate something, if you see a trending issue, definitely use your provider relations team to assist you with those issues and concerns.
Exactly.
Blanca, are you making site visits these days? Are you getting out to the provider?
We have been a little bit here and there as providers allow us to. Again, we manage to, well, my team manages more to the hospitals and things of that nature. We definitely have what we call joint operation committee meetings monthly. So we are definitely connected with our providers one way or the other. They love the Zoom. They love the, let's jump on a call and let's see each other. And it's not so much about the COVID stuff. A lot of our practices are really super busy. So we want to just be respectful of our providers' time and their managers' time. And sometimes, if they need to see us or speak to us at the drop of a dime, setting up a Zoom meeting right away works for us all. And we consider that a visit. Of course, if they require for us to be present face to face, we are definitely always open for that as well. So it's whatever works for the provider. We're here to accommodate you all as much as we can.
I talked to a provider contact earlier this week down in the south part of the state who said that they had just had a good meeting. It was actually with Peach State about some claims issues, but they had a good meeting with them and said things are certainly moving in a positive direction. I know I think it was with y'all, but forgive me if it wasn't, but somebody had gone through one of the payers had gone through a system upgrade or like a system change. So there were some issues with information not being consistent from maybe the old system to the new system as far as the provider information. So does any of that ring a bell? Is that something that you remember in recent months?
Not really. I
dealing
mean,
with?
Not really, but it
Okay.
could be. We're huge in Georgia, and there's so many things happening with different areas. And like I said, we service so many different areas. We've got people, reps and managers, directors in Macon. We've got Savannah. We've got, we're all in Georgia. So, different areas are going to have their own issues and concerns. But like I said, the provider relations, we are your first source, what we can always to escalate and push these issues through. Definitely, I love when providers make me aware of anything that's trending, because if it's happening one place, more than likely it's going to start happening in others. So we get in front of those things and we're able to escalate and work with our leadership. So that's always a good thing. One
of the hot topics in the industry right now, and it's not payer specific, is just denials, right? I mean, Tara mentioned, if they can help get a claim through and adjudicated the first time, and get it resolved and paid or whatever, that's great. Hospitals are definitely dealing with an increased number of denials. Some of those denials, many of them have to do with pre-auth and whatever else. So I know, again, I'm not putting you on the spot intentionally, other than just any feedback. I know other payers are adjusting some of their guidelines and restrictions around prior authorization, because they're trying to just help make the landscape a little bit easier, a little bit better for the providers out there. So you know, that's the thing. I mean, most of these hospitals, they certainly know what they're doing. They're getting those claims processed. They're getting prior authorization when they know it's required. And then a lot of times it's determined later on that maybe they didn't get pre-authorization because they didn't think it was required. And then when they submit the claim, it says no pre-authorization provided.
Mhm.
And that, you know, nothing more frustrating than the
Of
right hand
course.
not necessarily knowing what the left hand is doing.
Of course.
So, yeah.
And so, Bill, just so that everyone knows, we already have those type of things. We have those type of scenarios and responses and resolution in place. You know, in the
Great.
event somebody presents, I'll give you an example. You know, somebody presents to the emergency room and
Yep.
doesn't have their insurance on them. Nobody really knows what's going on right now. I mean, no one, you know, eligibility is of course important and needs to be validated, but sometimes that can't happen, and the service needs to be rendered and the member needs to be treated. So with that being said, sometimes it takes a few weeks or some time in order for the hospital to validate, okay, so this member came and said they had Medicaid, but they actually have Ambetter or something else. So now we can go ahead and bill those claims, but there's appeal processes and stuff of that nature where, again, utilizing your provider relations team is pivotal, reporting these things as timely as possible and allowing us to help you guys move those type of situations forward is definitely our protocol here. You know, internally, our leadership is awesome, working with me all the time. So I never have a situation that I can't present to them. As long as the provider, does their due diligence, you know, we need medical records and, you know, you're working on at least trying to, you know, file an appeal or make some sort of noise on the claim that you submitted and didn't get any traction on it. We can move it from there. So it's it's a partnership. It's always going to be a partnership.
Sure. Well, and I know they appreciate that perspective and that approach, because it definitely needs to be.
We definitely don't want to give like a solid no. You know what I'm saying?
Yeah.
We definitely want to be great partners and be able to see what happened, what's going on, and how we can assist with that claim. Especially, I speak mostly for hospitals because I see that really the most. And we know our hospital visits, those are pretty expensive and those are really high dollar claims. So we definitely just don't want to brush something like that under the rug and not give it any type of visibility. So we are definitely here from a PR perspective to help with that.
Good to know. So thank you. I would just ask all the attendees again, if you've got any questions, anything that you want to ask of these ladies today related to your experience with Ambetter and getting claims filed, getting claims paid, communication with Ambetter, anything that they didn't cover today. Are you okay with navigating the portal? Is there anything else that they can answer for you that would help make your job a little bit easier? Now would be the time to ask your question.
And Bill, I know you mentioned for us to get on the portal, but unfortunately that would be the secure side of things. So we would have to we would only have access working under someone else's TIN, and that would have like proproprietary information.
Right. Yeah. I just meant like the splash page. I just meant like the splash page of it.
No, for sure.
So, yeah, that's good. Okay. But from your experience, I mean, it's pretty easy to navigate.
Yeah. I feel like the web portal has been user-friendly. I mean, it really I know it like the back of my hand. Like once you log in, you know, you'll get right to the entry page. It'll show some claims that you've already committed to. And like I said, at the very top, it has just a few indicators. You can do eligibility, you can see your claims, you can see your membership, if you're a PCP, and you can file a reconsideration. There's also a little on the right-hand corner, a little space for you to send an email if you needed to communicate with somebody at customer service. Please take note, those emails do not come to your provider relations representative. That is customer service driven. So if you need to reach out to a provider relations representative, I highly suggest you get the territory list, which is out on the website in general. It's not proprietary, it's not on the secure side. So we're just out there, and then you send your email off to.
Has that list of contacts remained pretty consistent, or have you experienced a little bit of turnover as well?
No, not too much turnover. I mean, you know, here and there, provider relations is definitely not an easy department. So you will have, you know, some turnover here and there, but for the most part, like our leadership and stuff, I've been with the company for 16 years. Tara, how long have you been with us already? Like 10, 11?
8 years, almost 8.
8.
Yeah.
So I've been here for 16 years. Brittany Mathis, who's our vice president over provider relations, has been here the same amount of time as me, 16 years. So
Okay.
most of our leadership and most of our folks that are here have been here for quite some time.
Yeah, yeah, good. Okay. No, that's good to know.
Mhm.
Any upcoming provider events, anything else on the calendar you want folks to be aware of that as it relates to just other opportunities for them to connect with y'all or anything, I don't know,
I
workshops
know
or
that
open house
there's
type stuff?
conferences that happen throughout the whole year. I don't have a schedule of those, but I know
Okay.
providers are normally sent links and communication from those conferences so that you guys
Okay.
know it's a Medicaid conference, an Ambetter conference, who's the
Yep.
participators, like Peach State or WellCare. Well, there is no WellCare, so Peach State.
Yeah.
AmeriGroup, CareSource, all of us, if we're sponsors, you'll see our names on that list, and that means that we will be there in person.
Yeah. And
Mhm.
I would encourage both of you to share with your leadership as well, any of the HFMA sponsored events that are going on around the state. We've got one coming up in early May in North Atlanta at the Hotel Avalon, which will be a
Oh,
3-day,
nice.
essentially a 2.5-day education and networking event where
I love
providers will come
that.
together with some great education. And then also later on in November, we'll be back in Savannah. I know you've got a select member over there. We'll be over there in November
Yes.
for our fall conference. So
Well,
anytime you guys
definitely,
want,
Bill,
yeah,
definitely send that over to Brittany Mathis because
Yes,
she's our
please.
leader and she will be in charge. If you recommend that Tara and I go, we can go together. If time allots it, we can be live and take on the same amount of questions and be there to help our provider network with any questions and concerns.
yeah, no worries,
Mhm.
But I know it. I think I've had the chance to be with y'all, and I know that people would enjoy the opportunity to be with y'all in
Yeah,
person as
no,
well. So,
definitely. And we
yeah,
love that time too, so.
We
Yeah.
love our providers. Ambetter is, we're approaching about 330,000 members. And we
Mhm.
know that cannot be possible without our great providers. So
Oh,
we
yeah,
are all engaged,
absolutely.
totally engaged with our providers.
And I'm
Yeah,
always here for the good and the hard questions.
Yeah,
I know.
Bring it on.
Blanca's team is a great team. I
Yeah.
always enjoy working
I'm
with
always
Blanca and her
thinking about
team and the PR team because they come to the table ready and prepared to get to a resolution and to work together. So it's
Absolutely.
always a good time.
Yes.
You wouldn't be in this industry if you weren't willing to take on some of the more challenging times. That's for sure.
I'm here for the
You work-
challenge and I definitely love it because, like I said, I work very closely with our leadership and I never
Yeah.
have any problem bringing these things and these issues and concerns to the table. And I love that my leadership supports what I say and also gives me the platform to bring these issues to them and how we can come together to resolve them. So I'm
Yeah,
always.
the idea of filing and paying claims seems like it should be pretty simple in theory,
Yeah,
but we
it's
all
not
know
always
it's
that,
not
it's
always
not
that way.
always that cut and dry.
Yeah, every patient is different, every circumstance is
Absolutely.
different, and
Absolutely.
there's so many moving parts that sometimes
Yeah.
some of those moving parts aren't moving like you need them to. So I'm not seeing any questions come in, ladies. So if nobody else has any questions, let me just give a couple closing remarks. So I mentioned the Spring Institute for Georgia HFMA coming up in a few weeks, May 3rd through the 5th up at the Hotel Avalon. You can go to hfma.org, click on the Discover tab and go to Find My Chapter. Click on the Georgia chapter and it will tell you all about the chapter leadership. My friend Eric Burgeon is finishing up his year as chapter president, and he's going to be handing the reins over to Adam Gobin from Wellstar as the
Oh,
new
yay, I
incoming.
love Adam.
Yeah, the new incoming president for Georgia HFMA. And so they've got a lot of good momentum going into the new year, which starts for HFMA June 1st. And so I'd encourage everybody to look for that, as well as some other online and in-person events that the chapter's supporting and promoting. So
I love
thank
that.
you for your time today, ladies.
Yes,
It's
thank
very,
you,
very
guys.
much appreciated. Send me over your updated presentation when you can, and I'll just make sure that everybody gets that. And we appreciate it. And we'll be in touch the next time we host one of these. So
Thank you so much,
Bill.
Let us know, Bill. And thank you to all that joined, you guys. I see some familiar names. So everyone have a wonderful weekend and please let us know what we can do to help.
Thank
and
you.
we'll try to get started here a little bit early with Humana, maybe about 1:45. So just stay on the line if y'all want, put it on pause or whatever. I think we've got we're using the same link for the second one. It was just easier administratively to do it that way. So I'm going to go ahead and pause for now. Tara and Blanca, again, thank you so much. Yeah, and we'll catch up here. we'll catch up here, folks, in just a minute with Humana. Thanks
Thank
so much.
Thank you, guys. Have a great
Thanks.
weekend.
Hey, everybody. Good afternoon. Welcome to our sixth and final presentation of the week for the 2023 Georgia HFMA Virtual Payer Forum. I appreciate everybody's participation. We're going to go ahead and get started a little bit early today. We finished up the last session early. I appreciate those of you hanging on. And I suspect we'll have some more join us at the top of the hour. But again, for any of those of you who are new joining, I want to welcome you. Thank you for your support of Georgia HFMA. We've had a good week of payer communications and presentations, and you know, I know that the work you're doing out there is sometimes a thankless job, and I would just tell you to keep at it. Use the resources available to you, and we'll be in good shape, I think. And there, again, all of these payers this week, one of the common threads that I've seen is that all the payers have a lot of online resources available for the providers to utilize to get information about claim submissions, claim status, whatever it might be. So I encourage you to use that information as best as you can. I want to thank Katrina and Jessica for their participation today on behalf of Humana. We've reconnected with Humana here in the last couple of years, and they've been very supportive of the payer forums. And again, we're just trying to keep the lines of communication open. They'll share with you some updates and some information related to Humana's position in the market these days, and the best way to communicate with them, and familiarity with some of their services and resources, again, available to you as providers. I would encourage you to use the chat if you have any questions, the chat or the Q&A, to submit any questions for them. If for whatever reason they're not able to answer your question, we'll be sure to get the answer back out to you. So with that being said, I think I'm okay, Katrina, turn it over to you guys if that's all right with y'all.
Yep, great. We're ready. And thank
Go
you
right
so
ahead.
much. Yep, thank you so much, Bill, for the introduction. And you'll definitely see in my presentation that same common thread about using our online tools and resources. We have a lot of things available for our providers. So I'm going to go ahead and share my screen, and we'll get started. And Bill, just chime in if you're not seeing my screen correctly, but
no, looks good.
Should be able to see it. Okay, great. All right. Well, good afternoon, everybody. As Bill said, my name is Katrina Knight Vera. I am a contracting principal here at Humana. I've been with Humana for 17 years. I live here in Georgia. I live in Northeast Georgia. And on the phone with me, I have Chris Gentry, who is our market management consultant, and Jessica Bean, who is our population health strategy lead. All right, so here's some of the topics that we'll be covering today. But before we get into probably what you really want to hear about, which is how to do business with Humana, I'd like to first start by telling you a little bit about who we are. So what's Humana's purpose? It's our purpose is delivering sort of healthcare services to our members so that they can live healthy and happy. Since 1961, Humana has been committed to helping people live healthy and happy. How many of you know that Humana was initially founded as a nursing home company? We then transitioned to acquiring hospitals, at one point becoming the world's largest hospital company in the 80s. Caring for others is in our DNA. We want to offer our members personalized care from people who care. And we do this by listening to our members and creating solutions to help them reach the best version of themselves. We're also deeply invested in towns and cities across the country, and we strive to support and improve communities at a local level. In Georgia, let me just pause a second to move the screen. Okay, in Georgia, our members are supported by a network of over 38,000 PCPs and specialists, and 153 hospitals across the state. Humana is the largest individual Medicare Advantage payer in Georgia with over 316,000 members. We have 40% of the market share and we've captured 68% of the market growth from 2020 to 2023. So how has Humana become #1 in Medicare in Georgia? Our unique benefit design and diverse plan offerings not only provide benefits for medical care, we also include benefits to support members where they live, addressing the members' social determinants of health, including aid and transportation and help with food and security. In 2020, Humana leveraged the Medicare Advantage value-based insurance design model to offer the Healthy Food Card benefit to qualifying members in several states. The benefit can be used to purchase healthy groceries at various national retailers, and it comes in the form of a wallet card loaded each month with funds. This holistic approach will play a critical role in comprehensive treatment inside as well as outside the walls of the provider's office. Okay, I'll now turn it over to Jessica to talk about our health equity and social impact.
Thank you, Katrina. So good afternoon, everyone. I am really excited to talk about the updates that we've made to our health equity and social impact. Next slide, please. I want to go over our team and strategy. So what we're doing is we are naming our intentions. In 2022, the health equity and community engagement and the BOGO population health teams combined. So we are building on the foundation set by the achievement of our 2020 BOGO strategy and advance health equity across organization and with our members and our patient and our communities. So you may have been familiar with our Bold Gold. We've now combined those teams. Next slide. So what is going to be Humana's health equity strategic priorities? Well, first of all, we want to improve access to care. We know that primary care and preventative care screenings can help to reduce risk for diseases, disabilities, and deaths. So we strive to ensure that our members with the greatest needs have access to high quality and efficient primary and preventative care. And we also work to minimize issues associated with receiving care, such as transportation, literacy, and geographic and cost barriers. We are also making a priority to improve quality of care. We work to ensure members of all backgrounds receive the highest quality of care in every encounter through leveraging a value-based care approach. Additionally, we empower clinicians and all employees who engage with members to provide culturally competent, bias-free, and evidence-based care and support to each member with dignity. And like Katrina mentioned, some of the things that we're doing with our Healthy Foods Card, we're addressing barriers to healthy living through innovative products, services, benefits, provider relationships, and community partners, so that we can improve our social, behavioral, physical, and economic circumstances that stand in the way of our members and the communities achieving their full health potential. So this also includes addressing those social determinants of health that adversely impact their health. And those are the changes that we're making to the health equity and social impact. Those are our priorities moving forward. And I'll turn it back over to Katrina.
Thanks, Jessica. All right, now let's talk about Humana's value-based care model. Value-based care is a central strategy to improve quality and health outcomes while managing costs. Misalignment between providers and payers create an enormous waste in the healthcare system. By working together, payers and providers can reduce administrative complexity and combine data sources to better understand patients' health needs. Through partnership with providers, we can scale the best evidence about clinical delivery models that have been shown to improve outcomes and reduce costs. As our value-based care continues to gather momentum in the marketplace, we aspire to engage all providers in partnerships that align our interests with each other, and most importantly, with the needs of our members. Humana covered patients are benefiting from value-based care's preventive holistic approach. PCPs influence so many areas of health by determining which specialists achieve the best outcomes and referring patients to them, by focusing on educating patients about personal health, and by prescribing needed medications. Patients likewise have tremendous influence on their own health, such as deciding to participate in programs, changing their daily habits, and welcoming home-based services. They are the ones ultimately choosing to stay with both of us, the provider and payer, based upon the experience of the care they receive. As a health plan, we're able to influence a number of areas aimed at helping patients achieve their best health. We develop analytics and insights that help physicians identify care opportunities, trends in disease prevalence, outcomes, and costs. We can also help with chronic condition management, education, fitness programs, mail order pharmacy, affordable premiums, and predictable medical costs. Almost 2/3 of our Medicare members are aligned to providers under a value-based arrangement. This is important to Humana, and we continue to work to increase this percentage. We have proven data that shows that our Medicare members aligned to value-based providers receive more preventive screenings, have fewer hospital admissions, and drive lower medical costs, which in turn allows Humana to further enrich member benefits. We have a number of value-based programs available to PCPs and specialists that are designed to meet providers wherever they're at along the value-based continuum and support their progression to full risk if they choose to do so. Each value-based program from left to right builds upon itself, first offering incentive dollars for achieving quality and clinical measures, then maturing to offering upside-only shared savings based on the financial performance and management of Part A, B, and D expenses and revenue, and finally, full global risk. Okay, now let's talk about some of the resources available to you to help you care for your patients, because our members' health is in the hands of you, our network providers. That's why Humana is committed to supporting your practice with training resources, policy updates, and industry-leading patient care programs. If you go to humana.com/provider, you'll find that the webpage is broken down into 4 sections. First is the common tasks section, which contains links to authorizations and referrals, Availity login, drug lists, reconsideration and appeals, COVID resources, telehealth, and virtual care. Second is the claims training and notification section, which contains claims processing updates, coding guidelines, tutorials for working with Humana, a quarterly newsletter, and Humana's 2022 value-based care report. Third section contains patient care resources with a focus on health and quality initiatives. And the fourth section contains helpful resources such as how to join Humana's network, Availity Essentials portal link, and provider guides. For those physician practices on the phone, I'd highly encourage you all to subscribe to Humana Physician News. It's a quarterly newsletter for in-network physicians, clinicians, and office staff to support you in the care of your Humana-covered patients. As an example, in the latest newsletter, Humana provides a resource to help your patients stay on track with their well care visits and screenings by sending annual preventive care reminders. I'd like to share with you a couple of printable resource guides that can also be accessed via humana.com. The first is labeled Tools and Resources, and it's a 9-page PDF document that can be downloaded and saved by going to humana.com/making it easier. It provides an inventory of commonly used self-service tools and resources Humana created to make it easier for you to find the information that you need. The information is categorized by function to guide you more directly to what you need. This link also contains a 9-minute, 49-second video that walks you through each topic listed under the table of contents. The second printable resource guide is a resource sheet for healthcare providers. This resource sheet contains links, phone numbers, or general guidance on checking patient coverage, link to Humana's prior authorization list, steps for submitting pre-authorizations, pharmacy or medication pre-auths, how to submit a claim, how to check claim payment status, how to submit a claim appeal or dispute, how to manage overpayments, and training and education links. Humana requires a pre-authorization and notification for certain services to facilitate care coordination and maximize benefits for your patients. You can find the most current and up-to-date prior auth list on humana.com/provider under the Common Tasks section. A pre-auth can be requested online via Velity.com or by phone by calling Humana's IVR line, which the number is listed here in the slide. We strongly encourage providers to leverage Velity.com for the submission and management of prior auth requests. Here you can modify prior auths, check their status, and view 18 months of historical prior auths. Velity is payer agnostic, so you can manage auths across multiple payers through one site. For prior auths related to drugs, forms can be obtained via humana.com/medpa or by calling the number on the slide. If a provider is administering drugs in their office, a clinic, outpatient, or home setting, they can go to humana.com/medpa or send a fax to the number here on the slide. Claims processing. There are two ways to submit a claim: electronic claim submission or paper claim submission. Valid national provider identifiers are required on an electronic claim submission, and they're strongly encouraged for paper claims. If a paper claim does not have all the necessary NPIs, it may be denied or subject to delays in adjudication. Healthcare professionals and facilities can use the Velity portal and electronic data interchange services as no-cost solutions for submitting claims electronically. To register for the Velity portal or to learn more about Velity claim solutions, visit Velity.com. You may also file a claim by EDI through the clearinghouse of your choice. Some clearinghouses and vendors charge a service fee. Contact the clearinghouse for more information. If you're submitting a claim to a clearinghouse, you should use the Humana payer IDs 61101 for claims or 61102 for encounters. If it's necessary to submit a paper claim, please use the address on the back of the member's ID card. Okay, to inquire about a claim, you can call the phone number on the back of the member's ID card. A Humana provider service rep will log your call and provide you with a reference number. If your issue is not resolved during the call, the provider service rep will create a task into a shared enterprise tool similar to Salesforce, which routes to a specific department for further investigation and resolution. You'll receive an email confirming a receipt of the issue, as well as regular updates to inform you of the status of the inquiry. If you're not satisfied with the resolution of your inquiry, you can escalate the inquiry by emailing Humana Provider Services at humana.com with the reference number and the additional info that's listed here on the slide under step 2. At this point, you're probably seeing a theme that centers around technology and the migration from paper to more electronic automated solutions. Signing up for ERA EFT is easy, and you can do so via Velity.com. Electronic claims payment offers several advantages over traditional paper checks. For example, electronic claims payment can help with faster payment processing, reduced manual processes, access to online or electronic remittance information, reduced risk of lost or stolen checks. And with electronic funds transfer, Humana deposits your claims payments directly into the bank accounts of your choice. We also will enroll you for our electronic remittance advice, which replaces the paper version of your explanation of remittance. Physicians and other healthcare providers can use Humana's ERA EFT enrollment tool on the Velity portal to request enrollment or update your existing enrollment. Okay, e-business resources. Here are some of the key metrics we look at when it comes to provider service metrics. We look at the claim payment time cycle and the volume of calls being received. As you can see, 93% of clean claims are processed within 14 days, and Humana's call center received over 420,000 provider calls in just a little over 2 years. 3 out of every 4 provider calls are related to claim status and benefits. And I'm sure you've all experienced sometimes long wait times when you've called the 1-800 number. So with Avelity, however, providers can conduct business online quickly and easily. So you can focus on the well-being of our members, your patients. We've been talking about the functionality of Humana.com a lot, and it's great from the perspective of staying up to date and with how to best work with Humana, as it has claims payment policy information, provider manuals, PAL lists, etc. However, Avelity is used for more of the day-to-day office business functions, such as checking eligibility, co-pays, deductibles, check claim status, etc. Humana encourages provider administrators to use the Avelity Essentials portal. With Avelity, you can check patient eligibility and benefits, submit or manage pre-authorizations and referrals, review claim status and remittance documents, submit medical records, manage overpayments, sign up for electronic payments and remittance documents, and find Humana-specific apps, resources, and news. You only need one user ID and password to work with Humana and other participating payers in your region, and there's no cost to register. Avelity can also help you structure unique payment or reporting methods depending on the needs of your practice. Avelity integrates patient payments right into the Essentials workflows and includes cost-efficient payment processing. You can swipe a card or set up recurring payments to help spread the patient's cost out over time. Okay, so that concludes the presentation, and I will open it up to questions and answers.
Thanks so much, Katrina, and I appreciate your participation with all that. Good information. One of the things I was going to ask, this has come up earlier in the week with other payers that are also using Avelity. We had an example where someone had had a request for medical records. The medical records were submitted, and then later on through Avelity, there was indication that medical records had not been received. I don't know if people are experiencing that with Avelity and Humana, or if it was specific to this other payer, but I know the systems are not always completely in sync. But would you have any thoughts or comments? Do you ever hear about that happening, where one group says they received or had the medical records, or the hospital shows that they've clearly submitted the medical records, but they're not received on the other end?
I haven't heard it being an issue through Avelity. I've actually found Avelity to be the better way to submit medical records. I tend to find it happening more by mail. When providers are submitting them by mail. We usually give a couple different ways that you can submit medical records. I think there's usually a fax number where you can fax, but I've not had that come up about Avelity. I think I've heard Avelity is probably the easiest way to submit medical records.
Okay. Any other questions for our presenters today before we let them go? Anybody have anything? Nothing at all, huh? That must mean things are working pretty well.
And Bill, I think you've got my email in the chat. So if anybody does have something that they don't want to bring up on the call, if you just want to email me directly, I'd be happy to help anybody on the phone with any issues you're having.
Yeah, no, that'd be great. We would appreciate that. All right, if we don't have any other questions, I think we're okay to let you go. Did somebody else have a comment? Okay. All right. Well, we appreciate it. Oh, is he trying to talk?
Now I'm
Go
hearing
ahead.
some
I'm sorry.
I'm hearing feedback as well, Bill. So I wasn't sure if someone was asking a question or if it was just feedback.
No, I think, didn't you say Dean was dialing in?
No,
Did you
Chris
have-
is Chris is already on. Yep, he's on
Chris.
mute. Yep.
Yeah, I think it showed on my screen that maybe he was trying to say something.
I had my microphone open and you might have just heard some background noise. I apologize if,
Okay.
if it caused any confusion. I apologize.
No, no worries. No worries. Appreciate you joining us today.
No problem. It's a pleasure being here with you.
Thank you. All right.
Well, thank you, Bill. I guess there's not any other questions. So thank you so much for allowing us to join and present.
Yeah, I was just going to say for the folks listening, if they haven't been on earlier this week or today, Georgia HFMA has a Spring Institute coming up May 3rd through the 5th at the Hotel Avalon up in Alpharetta. You can go to hfma.org and click on the Discover tab and find my chapter. Go to the Georgia chapter and you'll see all the information about upcoming events as well as our leadership information about our chapter that may be of interest to you. So with that being said, happy Friday to everybody. Hope you have a wonderful weekend. I think tomorrow's going to be a great day. And I just want to thank everyone for their participation. Thanks again, Katrina, Jessica, Chris.
Thank you. Have a good weekend.
Thank you. Good weekend.
You guys
Thanks.
too.
Thank
Thanks.
you.